Let's talk about ergonomics today. So what is ergonomics? I know I've been saying this is an ergonomics lunch and learn, and that I'm a professional ergonomist. So what is ergonomics, right? Everyone, we probably have people trying to sell you ergonomic product, whatever, but really ergonomics is made of two Greek words. Ergo means work, and nomics is the science of something, or like the natural law of something. So really ergonomics as a whole is a natural law of work. So actually, I want you to maybe look around the room, or even look around this virtual room right now. If you can see that every human body is a little different, right? Some of us are going to be a little bigger, some of us going to be a little smaller. Some of us are going to be working differently, some of us are going to be left-handed. So if we're all created differently, if there are all these different body types out there, why should we be working the same, right? So really ergonomics is a science of fitting the task to the person, to the worker, to maximize productivity while reducing discomfort, fatigue, pain, injuries. And the really funny thing is, a lot of the times when you mention ergonomics, you think about, and people there are probably a number of products out there that's labeled quote unquote ergonomic, when the word ergonomics itself is really it's a scientific term, right? But a lot of times people just slap on the word ergonomics so that they could sell you something. So here's an example. I once got an ad that's for ergonomic potato chips. And I said, what's so special about that? And it turned out it's a bag of chips like anything else. It comes with a handle. You're supposed to fish it out in some special way that they call it ergonomic. But really, this is probably more or less just a fancy tag that they add on in order to sell you a product, right? But now that you know the definition of ergonomics, just a natural science of work, hopefully you won't be fooled by just a fancy tag. And then hopefully by the end of the session, you have learned something to configure your workstation in a way that would be most beneficial for your body and your own work habits. Okay, so some of the learning objectives today. I want to start just by discussing MSDS stands for musculoskeletal discomfort or injuries, right? That's the physical injuries that our body sustain from work, right? And then I want to discuss the 5-step operatory setup for obtaining and maintaining balanced posture at work. We'll be talking about some counterbalance stretches. So these are some really simple exercises you could do at home or even in your operatory in order to keep those muscles as balanced as possible throughout the day. If we have time, we can talk about surgical loops. So those are the magnification devices you can wear around your eyes to help you see better, to help you get into better posture. We'll see if we have time. If not, perhaps we could do a part 2 if you guys are interested. And also, because it's the first lunch and learn we have, we really welcome any feedback you may have. And also, if any of you are aspiring speakers, if you feel like you could quote unquote stand in front of 30 people and give a bit of a talk, we'd be interested in having you as a speaker as well. Okay. Right, so I think all of us, we can say in dentistry and dental hygiene, we don't work as we should. And if anything, we probably see the opposite. Instead of configuring the workstation, the operatory to fit our body and our needs, what ended up happening is that we work for our equipment instead of having our equipment work for us. Right, look, if you've been practicing recently, this is probably one of us at some point. This is probably one of our colleagues. I see people nodding. Yeah, that's it. Right, and I think this is all of us at some point, right? Whether it's giving outlay, whatever. But I don't think, and I've done this many times where I will go to a dental office and to do some sort of consultation for someone, someone who's experiencing discomfort. And if I were to take photos of them or show them some photos of people working, and I say, does this look comfortable? What I find is that you don't need a fancy degree to say this isn't comfortable, right? Whether it's this, whether it's the pressure on neck and shoulders. For this guy over here, he's bending over, his neck is bent, his arms is swinging all the way out, right? So you don't really need a degree to say that's uncomfortable. So now the issue is, how do we configure the workstation in a way that we minimize this while still be able to perform the work that we need? And this picture just always gives me a laugh when I look at it. Something somewhere went terribly wrong throughout the process. So I'm going to share a little bit of research with you. This one is from a little, just under 20, in the early 2000s. But until this day, it is still one of the largest scale studies that's ever done in dental practice. This one had, I think, over 400 dental professionals surveyed. As we can see, right, like there's basically throughout the body, especially, it was probably in upper body more than lower body, but overall, we see that pretty much everyone, whether it's dentist, hygienist, whatever, experience some level of pain and discomfort at some point of their career over 1 year time, right, as high as 75%. And we can see consistently, right, that us dental hygienists gets it more severely than our dental counterparts. A lot of it, I think, is because, and actually I think I'll probably go into that a little more, is that our work's more repetitive, right? I can see some of you nodding again. Hygiene, the work is very repetitive throughout the hour, whereas for the dentist, at least he gets to do something different depending on what patient, the type of work you perform, as a filling, it's a crown, whatever. Whereas for dental hygiene, our work tends to be very repetitive, and and the data shows, you can see from here, right, that we are at even higher risk of discomfort and pain and injuries than our dentist counterparts, right? So up to 67% of dentists in the study, they say they lost days to practice each year because of pain and discomfort that's fully preventable. Not surprised, but hygienists report higher, right? Some of it is, again, I said, is the repetition of the work. The other thing is that females are more likely to report pain. It is not because we are whinier. If anything, I think we all know that females are more able to sustain pain, right? But it is, a lot of it is a hormonal changes throughout our body, throughout our lifetime, right? Going from early 20s to 30s to 50s to maybe 70s, right? Our body changes a lot hormonally comparing to males, and we know there's some hormonal associations between pain as well. But together, right, as profession, we experience a lot of pain and discomfort. And what are we doing about it? A lot of times, unfortunately, nothing. Right? It turned out that 60%, 3 out of 5 dentists just say, oh, we're living with it. And we see very similar numbers among dental hygiene. 76% say, you know what, we're living with it. I went to a dental conference, the Greater New York Dental Meeting, a few years ago, actually to promote an ergonomic assessment service. And when I asked the people that came to our booth, I said, hey, do you experience pain? What are you doing about it? And most likely they're saying, we're doing nothing. You're making dentist money. You shouldn't be complaining. This is something that comes with the profession. But is it? Is it that, in my opinion, really is that nobody should be living with pain and discomfort that could be avoidable at work. And the sad truth is that we rarely practice as we should, right? If you just look at people who work, I think some of these are in a more of a surgical environment. Some of these are regular hygienists in a clinical setting. A lot of times we're not practicing anywhere near a balanced posture. So that brings the question, right? And then we can see like the amount of pressure, the amount of stress is on your body is quite a bit, just by bending forward throughout the day, because the way the human body is structured. For example, the human head is actually quite heavy. Like our head weighs about as much as a baseball almost. And the result of it is that when you're bending over like that, right, it puts a lot of stress and tension on the spine. And the spine is one big thing, is from the neck all the way down to your lower back, right? So any sort of pressure on the spine over a long period of time could definitely add a lot of stress and tension. And the clinical manifestations of it would have been, pain, discomfort, limited motions, anywhere from your neck, upper back, lower back, right? So, and I've been saying what is balance? I've been saying balanced posture, we're practicing out of balance. So what exactly, is balanced posture? What puts us in balance? And does it really mean that you have to stand on a yoga mat and balance on one foot? Like, what is balanced posture? So let's take a look. I know that there are a lot of words on this slide, so I'm just going to read over it, and I'm going to be highlighting some of the key concepts in here. So balanced posture is achieved as a natural, comfortable position to allow optimal physical control for performance of fine motor clinical activities. Optimal balance is derived through proprioceptive self-derivation. This allows you to proceed with minimal physical stress. So what it's trying to say is that a few things I want to highlight, right? Natural, comfortable position. And the other thing is self-derived. So there's a big word here and people ask me what it means, proprioceptive. So what that is, it's your body's sense of space. So when we're sitting somewhere, doing something you do all day, you always know where your body is, right? You don't have to look at your right hand to see where it is. You don't have to look at your foot to see where it is. So it is really, what that really trying to say is that this balanced posture should be able to come from you. We'll be giving you some guidelines and some things to think about, but at the end of the day, these balanced postures are self-derived, so it comes from you. And we do understand that there are going to be small variations of posture depending on your body type, depending on the type of work you perform. So there will be small variations between people, because we want these balanced postures to be self-derived, to come from yourself. Okay, so I said I'll be giving some guidelines as to what balanced posture look like. So I'm just going to be talking through this picture, and then we'll be talking about how to configure your workstation. So I will be going from top to bottom. I think that'll make a lot of sense. All right, so when you're sitting, you want to make sure that you're able to, when you look down, without bending your neck excessively, right? She's bending her neck a little bit, but she's not bending her neck so excessively that it's putting a lot of pressure on her spine. So when you look down naturally, you should be able to see the oral cavity of the patient that you're working with, right? Again, we said no excessive bending of the neck. Your shoulders should be relaxed instead of that shrugging kind of motion. Your shoulders should be very relaxed all the time. And the patient's oral cavity ideally is aligned with your heart level or maybe just below. You should allow some clearance from underneath the chair to where your knees are, so that nothing's pressing on your legs and cutting off circulation there, right? Your knees and hips are roughly at the same height. Your hips can be a little bit above your knees if you need to, but you want to make sure that your feet can touch the ground. It's very important that we're able to reach the floor, because your feet is where your sense of gravity come from. Right? We talked about your body sense, your sense of your sense of body in the space, right? So you may make sure that your feet can touch the floor, and the chair you're sitting on should allow easy movement throughout the entire aperture. As in, when you're sitting, you should be able to easily move around, instead of sitting in some sort of a dinner table chair or whatever that restricts your movement. So these are some things to keep in mind. And we'll just go over, like I said, I'll be giving you some guidelines, right? So let's go over the 5 steps to achieving this balanced posture. And most of us will be seated throughout the day. I know some people practice stand-up dentistry. There's actually quite a bit of debate over seating versus standing dentistry. But what we've seen is that because dentistry 100 years ago or 150 years ago was a standing profession. Like dentists, if you look at old photos, dentists stand, right? And then around the 60s, there was movement to sit down. And then what we saw was that going from standing to sitting is that what it did, it actually moved issues from lower body to upper body. So dentists used to suffer from leg pain the most. And then when dental professionals started sitting down, we started seeing neck, shoulder, upper body pain. So the discomfort didn't go away, it got moved around, right? So here I'll primarily be focusing on sitting. If you do stand, we can maybe during the question and answer kind of go over that a little bit too. We want to know how your oral cavity is positioned. The maxillary play maxillary plane of the patient. We want to make sure that's positioned properly. The operator's leg should be free of any compression from the underneath the chair and the leg of the operator. So I'll show you what I mean by each thing. So seated, right? I know we sit all day. If you look at it, an average person probably sits something like 8 to 10 hours a day. So that's definitely a lot of sitting. That's more than a third of your day is you spend in a seated posture. So how do we sit and sit well? So a few things to watch out for. You want some sort of seat that would have a little bit of back support. And this back support should be roughly, like I'm gonna ask everyone to put your hands down to kind of your lower back. There's that kind of like that dented area in your lower back, just above your hips. So ideally the backrest of the chair should be supporting that spot right there so that it maintains the natural shape of the spine. So realistic, the backrest you got right there. I see some people nodding. They're like, yeah, I'm getting it. Okay, the chair you're sitting on, ideally you want to leave a little bit of space from the edge of the chair, between the edge of the chair and the back of your knees. The idea behind that is that you want to be able to sit and have enough support for your lower body, but at the same time, you want to have some space so that the edge of the chair isn't digging into the back of your knees, again, affecting circulation in the legs. So you want to be able to have a chair that's that supports your lower body while leaving a little bit of space from the edge to the back of the knees. It shouldn't be so, I think ideally it's about 2 or 3 fingers. That's what current research says. So it shouldn't be so long, it's pushing, but it shouldn't be so short you feel like you have no chair to sit on. So just a few fingers of space right here. Your feet should be touching the ground, like I said, because it's the feet it's through our feet that we sense the center of gravity. That's where it is. See, so our feet should always be able to touch the ground. So your chair should be height adjustable in a sense that it allows that to happen, right? And then you want to have wheels or some sort of mechanism allow you to freely move around in the opportunity. So that's the chair. And position of the oral cavity. So let me see. Actually, this will make sense. So a lot of this perhaps depends a little bit on where you put your patient right now. But you know how a few slides ago I said there should be these positions should somewhat be self-derived, right? So I actually, if possible, I would like you to do an exercise with me. So I want everyone, if you could, actually I'm gonna do that too. If you could, I'm gonna ask you to sit down, and just sit down comfortably, lean back in the chair, make sure you have some back support. I want you to close your eyes. And we do this with all our first year dental hygiene students. And this is called the self-derivation to find out where your ideal working height is. Okay, so make sure your neck and shoulders relaxed. I want you to take one deep breath. Breathe in and breathe out. All right. Okay, now I want you to put your hands in front of you and just think about doing something that's fine movements all day. It could be scaling if you are like an office, like you're like a receptionist, whatever. Think typing, right? Something you want to just think some fine movements that you could do all day. Put your hands in front of you while keeping your neck, shoulders relaxed. Keep your hands in front of you. Okay, and then when you're ready, open your eyes and see where your hands are. Right, so whenever you're ready, you can open your eyes and see where your hands are. Chances are it's not up here close to your chin. It's going to be somewhere in the lower half, so somewhere from your heart, somewhere at your heart level or just below. And this is what the self-derivation is knowing where you could work all day without feeling any stress to your neck and shoulders. So chances are it's going to be somewhere between your heart and your belly button, probably closer to the heart than the belly button. So we once in a while get a person who say, oh, I work all the way up here, closer to my chin, I'm comfortable, but it's really, really rare. You see that maybe 1 out of 100 people. Most of the time when you ask them to find a position where their neck and shoulders relax, where you can put your hands in front of you and do some sort of fine movement all day, this is gonna be just about heart level or below. Once you find that, you got to make sure your patient, the oral cavity of your patient is right about that height. Okay, and the other thing is you want to have clearance around the patient head to allow access to all quadrants, right? So often I say, where do you work? People usually say, oh, I sit in 9 o'clock all day, and that's it. But what realistically for hygienists to, and dentists and hygienists, but hygienists a little more so, and I'll explain why. For us to be able to have access to all the quadrants, all the surfaces. For right-hand operators, you need to go from 10 o'clock to about 12:30. And if you are a left-hand operator, the mirroring opposite. So from about 2 o'clock to about 11:30, right? So if you're left-handed, it's the other direction. Either way, you need this much clearance around the person's head so that you can move around. And I said it is more important for hygienists, almost more important for hygienists and dentists, because when you think about it, if a dentist has something to do in an hour, chances are he's working on one tooth, right? He's doing a filling, a crown, something. He's working on one area. So once he sits down, he's locked in that position. He's gonna be, if he's comfortable, he's good for that hour. Hygiene, on the other hand, has to access the entire mouth within an hour, right? So you really need that clearance to be able to access all quadrants and all surfaces. I have a personal story, actually. I was working for a dentist where he gave me a room, and there was a huge, gigantic post in the middle of the room. And I said, I cannot work like this. Every time I try to go to a particular part of the mouth, I hit the post. And the dentist says, well, what's the problem? The last guy there was an endodontist. He was there for 20 years. He never complained. I said, think about the task you do, right? An endodontist, when he zeroes in on one tooth, he's there for 2 hours. Once he's comfortable, he doesn't have to move. I, on the other hand, have to access the entire mouth within, an hour, whatever time that I was allowed. So he eventually did move me to a different room after I explained what it was. But I think that really was eye-opening to help me see what the issues and challenges many of us could face. So again, right, this is what happens when you don't have clearance. You end up winging your arm out. So if you have clearance, then you could move close to where that arm is winging, and then automatically you would be more balanced. So next one up would be the position of the maxillary plane, right? So when we are working on the upper teeth, on the maxillary arch, we want to make sure we have about a -7 degrees. So I know it's a little hard to visualize, so I drew these arrows. So if straight up is 0, -7 is something, imagine, like towards you. So basically you want, when you're working on the upper teeth, ideally you want your patient to just tilt up a little bit, right? So to be able to access the maxillary plane. And when the only exception here is perhaps the lingual surfaces on that quadrant 2, yeah, over there on the upper left. I'm training Canada, so I'm using that number system was quadrant 1, 2, 3, 4. I know in the U.S. the numbering is different, so which is gonna say the upper left on the lingual side. So imagine if you could sit over here and access that directly, because so often we see people do indirect vision with a mirror, and they do that whole side using a mirror. It's not that you can't do that, but what we find is that if you could do a combination of direct, indirect vision, if you could sit at 9 o'clock and ask your patient to tilt up a little further, sometimes that will allow you a way more clear access of those surfaces. So that's the max when you're working on the maxillary or the top arch, right? So -1, so up to -25 if you can. For the bottom, we almost want to do the opposite. You want your patient to actually chin down a little bit. So this is how I talk to the patient, chin up, chin down, to help them kind of navigate through the process. I know some of you are probably thinking, my patient doesn't like to be put that far back, right? So the thing is, what I found is that if they cannot move that far back, a lot of them are able to chin up and chin down for you. They just want to be able to have some sense of control, that they don't want to be put really far back, and I get that. But even the people that say they can't be put far back, if you communicate it and you say, I need to be able to see so that I could do a better job for you, and I ask them to move their own to move their own head. That seems to I have a lot more success doing that than trying to move them myself, right, by moving them in the chair, right? So for the lower arch, you want to chin down a bit so that you could have better vision and better access. So if we say again, if straight up is 0, going for chinning down would be about plus 8 degrees, right there. So just to show you again with a real patient, so it's not a dental form. -7, right, for the maxillary will look something like that. So if you want to work on your upper teeth, you want your patient to chin up a little bit as much as possible. If you're working on the maxillary linguals on that surface, on quadrant 2 over there, if you can get them to chin up a little more to about -25 degrees, then a lot of times you could have a really nice and clear access of that part of the mouth. -25. Again, mandibular arch, right? If you're mostly working on that, then you want to chin down a bit to allow more clear vision and access. And the other thing that helps is whenever possible, ask your patient to move, because they're there for an hour. You're there all day. And so think about that. I know a lot of people say, oh, I'm not comfortable asking you to move. A lot of it, I think, is communication, is to be able to say, hey, I need you to move a little bit so that I could see better, I could do a better job for you. Most patients I have end up following that somewhat, at least to some extent. So next thing I want to talk about is the clearance between the bottom, between the bottom of the chair to your knees. So you want to make sure you have some clearance over there, so that the edge of the chair isn't digging into the top of your knees. And actually we have a photo, an example right here when you don't have clearance. See what happens is that you're actually kind of stuck underneath the chair. It limits your movement around the chair. And also, right, there's potentially this cutting off circulation on your legs because the edge of the chair is resting on your thighs there. Next one thing I want to talk about is, or the last but not least, in terms of criteria to set up your workstation, is the position of the light. This one, I like people to actually be a little open-minded about it because I know many of us are trained differently. So I'll show you the research and what it's about. So we want the light actually to be about 15 degrees from your eye line. So if the eye line is from your eyes to the oral cavity of the patient, then the light should be just about a little bit further away from your head. I know a lot of us were taught basically putting the light over here, or even close to the belly of the patient. And I know, even though perhaps, you know, this is how you always been working, whatever, but if you look at just the shadows on the surfaces, right? If let's say if you're doing this case, if you're doing a prep, a molar, right? You could see so much better. There's so much less shadows when the light is just within 15 degrees of your eyesight, within your eye line, as opposed to further and further. And when you have it on the belly, you have a lot of shadows, and you end up tweaking the light more, thinking there's something wrong with it. But a lot of times you could just move it a little closer to your eye line. It makes a huge difference. So if you haven't done that already in your practice, try that. And another benefit of keeping the light over here is that if you start really bending over into your patient, you're going to block your own light. So, and then you can't see anything. So it is a mechanism that allow you to sit back and into a more balanced posture. Because if you bend any further, you would be in the way of your own light. So that reminding you to sit back a little bit and not fully hunch over the oral cavity of your patient. So I wanted to show you guys a few photos. And the scary thing is I pulled these photos from brochures from public health websites, from dental schools, hygiene schools. And it's scary. It just shows how prominent the problem is. So I want everyone to just look at this photo and think about it. What's wrong with this photo? I know from the very obvious violation of infection control, because the dentist is not wearing a mask, what's wrong with this photo? Right, as we can see, he has no clearance behind the patient. They're both hunching over quite a bit. the patient's being put way like in too much of a seated position instead of more reclined, so that he could actually access the different quadrants we talked about, right? So these are a few things that just by looking at a photo, you realize there are a few things going on here. And I want to kind of do a few more of these mental exercises because unfortunately in the webinar position, I can't ask somebody to point it out. What's wrong with this photo, right? Again, she has zero clearance right here. So she has to, instead of sitting behind the patient around 12 o'clock, they're sitting towards 9 o'clock and then again, hunching over, bending of the arm, things like that. So if I were her, I would see if I have clearance over here, I most likely would sit behind the patient. I probably ask the patient in this case to move a little closer to me so that I can have access while I was sitting closer to 12 o'clock. Right? So I think one of the issue that's happening here is that she didn't have clearance enough space behind the headrest to be able to sit here. Very similar with this photo here. What's wrong with it? I think again, this is an issue, two things. I think two things. One is a clearance, right? Again, there's probably not enough space for him to sit there, to sit behind the patient and not pulling this almost like a yoga-like posture. And the only other issue here is the height of the chair. The height is impinging on the thighs of the operator, again, affecting circulation down the legs. So if I were to give him some sort of advice, I again would recommend that he sit closer to 12 o'clock. I think the other issue here is his light is really far away, right? The light is almost on the chest, even on the belly of the patient, rather than being pulled closer to him, so that he has better view of the area he's working on. What's wrong with this picture? Again, right? See how the back of the headrest is digging into your knees. I think she might be sitting a little too high, right? Because you know how we said the hips and knees should roughly be the same height, but instead the hips are a lot higher than the knees. So I don't know if her feet are able to touch the ground, like we said. This could be a person whose chair is not adjusted to the right height, and as a result, the patient has to be put in the more sitting position instead of a reclined position as well, right? So I would, in her case, I might want to recommend that she adjust the chair height, that she could sit lower, she could recline the patient more. I can't really tell if she has enough space to sit behind the patient, but that could be a way about it, right? So again, more clearance, put your patient in a more supine position, and also be able to adjust the height of the chair so that it allows you to sit with the oral cavity at your heart level or just below. Okay, so we're gonna, now that we talked about all these little different things you could do to set up your operatory, right? But aside from that, we can also do some stretches that really help balance out the stress and the tension on the muscles throughout the day. So if you have space, I recommend that you stand up with me, and we're gonna do these stretches together. If you don't, maybe mentally do your head, and then we'll talk about that. Okay. All right, so I'm gonna show you two different counterbalance stretches that I personally find really, really helpful. So the first one, we call them counterbalance because they are supposed to be balancing out, right? Balancing out muscles that's stressed out at work. So I want everyone just to stand on your feet, and you want your feet to be about shoulder width apart, and you want to put your hands behind your back, right? And whenever you're ready, I want you to breathe and just extend back, right? And for if some of you, if this hurts you, a modification could be that you put your hands on your hips instead of on your back. You want to put your hands on your hips and just do the extension on the back. The reason we do that is because a lot of times, right, when you're working your patients in front of you, so all your energy, all your effort is forward in front of your body. So by doing a counterbalance, what we're doing is that we are stretching in the opposite direction to stretch out the muscles. So the muscles that are been contracting all day will get a chance to relax, and vice versa. Right? And do that for a few minutes. When you're ready, just come back. And if you want to do the modified version, because some of us may have hip injuries or hip tightness, discomfort, You just put your hands on your hips. And again, do a little back bend. You can breathe while you do it. Breathe in and breathe out. There we go. So this is something you can do during your breaks, right? Right. So you don't have to go outside. You can be in an laboratory and be able to do that. Another very similar one, as we talked about this already, is the putting your hands on your hips as a modification. So I showed that. The other exercise we could do, this one came from Pilates. This is one of my favorite moves in Pilates because you know how we talked about balance and finding your sense of balance and self-derived posture, things like that, right? So I want everyone to, again, stand up if you can. Right, put your hands in front of you. Your feet should be just about shoulder width apart. And when you're ready, breathe in and just swing your arms up all the way to the top. Stand on your tippy toes if you can. And breathe in. And stay there for about a couple of seconds. And when you're done, breathe out and come back out again. All right. Let's do it a second time. You want to breathe in, swing your arms up, and just reach up. All right. And then when you're done, come back down, breathe out. All right. Wonderful. I see some of you on video doing that with me. That's really good. So this is a move in Pilates that's aimed to reestablish a sense of balance, sense of gravity within your body. Right? So just by doing that a few times and breathing with it, it will help us reestablish our center if you're feeling like you're out of balance. So between patients perhaps, or you know, at lunchtime, whatever, you can always do that to, again, help us find the center of gravity. And that will also help us find the sense of center and balance throughout the day. Okay, so let's see. We don't have a lot of time left because I do want to allow some time for questions and things like that. So I think I'll wrap up with a statement where I know at the beginning, I said that ergonomics is a science of, I think I have something in the background. Sorry about that. So I said at the beginning, I said ergonomics is a science of work, right? It's a natural laws of work. However, I want you guys to understand that ergonomics is also a science of change. So at the end of the day, it is in your hands. So you have a special and unique opportunity to make a few life-determining choices and changes about how you will work in your profession and also how you will live. Because at the end of the day, maybe right now you're 10 years, 20 years into your profession, but at some point you're thinking, right, it's your retirement, it's your quality of life, right? When you retire, you want to be able to throw a ball with your grandchildren. You want to be able to go on a cruise. You want to be able to go to the beach. You know, these really wonderful things. So really, at the end of the day, it's a change that has come from you. It's a decision that we have to make, and at the end, and it is our quality of life at the end. Okay, so I think we'll have to leave social loops to a different time. So if you guys are interested, you can maybe put in the chat and tell us if you're interested in hearing a second section on surgical loops. It makes sense, I think, to talk about this if you're interested after today, because the way I see it is that, you know, basic ergonomics and the way things are set up, I'm gonna close the window, sorry guys. I think it's either leaf day or garbage day in my neighborhood today. My apologies. So I was saying it probably would make a little more sense for us to talk surgical magnification after we have some understanding of what balanced postures are. So if you guys are interested, this will be maybe a really nice day too, if you guys are interested. Okay. So with that, I am going to wrap up and then just open the floor up for questions. So basically, yeah, with Willo, we will be releasing the product in phases. As we said, you guys probably saw us at one of the dental shows last year already. Willo is expected to hit the market in phases, but towards summer, I think our initial releases, and then we'll do a full on-market launch towards the end of the year. You'll most likely hear from us from ADHA this year, whether it's through the conference or through some other events that they put together. So this is something that we really look forward to sharing with the dental community, and yeah, we look forward to